Welcome back. In today's checklist, an important reminder about our health this holiday season.
Flu cases are spiking just as we get ready to gather around the table with family and friends. And as we deck the halls, this time of year can also bring an uptick in accidents around the house.
So here to help us stay merry, bright, and healthy all through the holidays is NBC News medical contributor Dr. Natalie Azar. Dr. Azar, nice to see you again this morning. It's been so long.
I know.
Okay, walk us through why are we seeing this uptick, and what can you do if you actually get sick?
Yeah, well, okay, so first of all, the theory, which is correct, is that we are seeing a variant that's circulating right now called the H3N2. It is an influenza A strain that we normally do see every year, but it usually does cause more severe illness. And it's evading the immunity from the vaccine a little bit, which means people are more likely to get infected, not more likely to get really, really sick. When you are traveling, I want people to know symptoms, right? And so I think one of the easiest things to remember is with a cold, you're talking from the neck up. A runny nose, a sore throat, a dry cough. Flu, COVID, you start to feel more aches, more chills, more potential for shortness of breath, things like whole body with fever. RSV, wheezing is sort of the telltale hallmark symptom. Take a home test. There's tests right now that can combine influenza A, B, and COVID. Stay home if you're sick, or wear a mask if you are the one who is sick and you're going to be around other people, especially older folks like grandparents.
So many of us, maybe not all of us, will be preparing meals for family this time of year. If you happen to cut yourself, at what point do you need to be concerned?
Okay, so the number one thing you're going to do first is you're going to wash your own hands when you're cleaning a cut on yourself or somebody else. You're going to apply direct pressure to stop the bleeding with like a clean cloth. You can clean the wound with a soap and water or like a saline or a solution. You don't want to use a harsh antiseptic like hydrogen peroxide on a wound.
Yeah, those days are over.
Yeah, because you know what?
Some peroxide on
We're not doing that anymore.
It kills the good bacteria too, so you don't need to.
Oh, okay.
You want to put on a triple antibiotic ointment like a Neosporin, cover with a bandage, and change it once a day. Things where you might say, this cut might be a little bit too much to handle at home. I need to go to the emergency room. A large cut, a gaping wound, something that continues to bleed. You can't move the finger or something that became involved. Numbness, right? That would be concern for nerve damage. Go straight to the emergency room.
Are emergency rooms busier this time of year?
Yes.
Okay.
Next question.
But that shouldn't deter you from going.
No, 100% you still go.
So let's say you are traveling and you need a prescription or you need to see a doctor. I mean, what are you supposed to do when you're not in your hometown?
So the first thing to do is to call your doctor's office. Either he or she will either be working or they will have coverage. We always can and do call in prescriptions to a pharmacy in another state. If you can't reach your doctor and you're having symptoms of concern, of course, you're going to find a local urgent care. If you can do a telehealth visit, that's great. The issue is that your doctor, your provider, in most states, needs to be licensed in the state where the patient is. So that doesn't always work if you're crossing state lines. And obviously seek emergency care if needed. What does that mean? Chest pain, shortness of breath, super high fever, intractable vomiting. You're not staying home or going to urgent care. You want to go to the emergency room.
The streets are so slippery right now, and sometimes I don't make always the best choices on my shoe wear.
Right.
If you have a bad fall and you hit your head, should you always go to a doctor or emergency room?
Not necessarily, but there is a pretty long list of things that we want to look for, warning signs that might say, get this evaluated. Any loss of consciousness. You know, some emergency rooms will say, like, if more than a minute. I'm like, if you lose consciousness, 30, 40 seconds, you should be evaluated. If you have severe or a worsening headache, neurological and physical signs. So what does that mean? Confusion, agitation, weakness, numbness, balance problems. Seek evaluation. Continuous vomiting. This sounds a little scary. Fluid leakage.
I think you would go to the ER.
Yeah, right. Like blood is coming out of your nose or clear fluid is coming out of your nose or your ears, definitely a concern. If you're on blood thinners and you have a fall, that is something else, and that might be it.
I think you covered it. I think that was quite thorough.
Like, there must be more on the list. We never get through everything.
There was so much in your brain this morning.
There was a lot, and it's just going to go.
And now it's.
Thank you.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.